Today, you will listen to our presentation about the ventromedial prefrontal cortex and the possibilities for PTSD treatment. We will discuss an original study conducted by the University of Texas at Austin. We will also look at a secondary source discussing the study found in Science Daily. Finally, we will use 3 additional sources to help show disapproval or support for the findings presented in the original study. In order for us to present the studies, there is important background information you must understand. For the next 2 slides, I will explain the background information that is important. The studies we researched focus on exposure therapy. It is important because it's a known treatment for PTSD. PTSD stands for post-traumatic stress disorder. It is well known because of its frequency for war veterans. However, PTSD can be caused by many different traumatic events, such as sexual abuse. Other examples are listed on the current slide. There are many side effects as well, including nightmares, personality changes such as extreme anger, numbness, and flashbacks, and those are just a few to mention. While there are many treatments available, medication exposure therapy are among the most common, and there's always ways to improve. So, what is exposure therapy? Well, in the most simple of terms, it is a way for people to confront their fears in a safe environment. There are 4 main different forms of exposure therapy. The first one is in vivo exposure. It's facing the fear in real life. So if someone was afraid of snakes, we would have the person hold a snake and see that it's not as bad. The second one is virtual reality exposure. It's not practical in most cases because of the fact that we can't have virtual reality everywhere. But it could be used in examples such as a simulation of a war combat situation. So we're not actually putting them there, but they can relive it. The next one is similar to that, since it's called imaginal exposure, which uses recall and imagining to have the person rethink of the situation that causes fear. So a war veteran, using the same example as above, would be thinking of a combat situation they were in. They would describe it and have to remember it, but they're in a safe environment when they won't get hurt. The last one is interoceptive exposure. What we do is we try and have the physical symptoms brought on, and we show that they are not dangerous, such as using running. So it increases your heart rate, makes it harder to breathe. But in the end, you're still okay because all you were doing is running. So it shows that that physical symptom isn't as big of a deal. The previous slide focused on big picture ideas that were important to the study. This slide is going to focus on 2 smaller aspects that are just as important to understanding the studies. First is an fMRI, which stands for Functioning Magnetic Resonance Imaging. In the study, an fMRI is used to measure brain activity, specifically in the VM-PFC. fMRIs are a great form of technology that uses a complicated magnetic system to detect small changes in the blood flow and brain activity. This can then be used to make a picture of the brain. It's important because it can be used to detect brain abnormalities that other imaging techniques are not able to find. It's also non-invasive and a safe technology to use. Earlier, I mentioned it being used to measure brain activity in the VM-PFC. The VM-PFC is a part of the brain. The full name is ventromedial prefrontal cortex. In the study, it is a main focus and watched carefully since it has connections to emotion processing, extinction of conditioned fear, and fear extinction over time. Those connections are very important while studying exposure therapy, as you will soon see. So now that we've presented some of the background information that's important, we can get into the original study. The original study is titled The Role of Human Ventromedial Prefrontal Cortex in Learning and Recall of Enhanced Extinction. It was done by the Department of Psychiatry at the University of Texas at Austin. The first aspect of the study we will look at is the hypothesis. Stated on the screen, it says that replacing a threat with a neutral sound instead of just emitting it engages the VM-PFC more effectively and allows for extinction to come easier. When studying extinction, a common practice is to shock somebody when they see a certain picture or press a certain button. Over time, the shocks stop happening. What they're saying is by getting rid of just the shock, the extinction will happen, but it won't stay as long or come as quickly. So if they take the shock and get rid of it, and then add a neutral noise or tone, it will make it so that it is more effective and it lasts longer. When looking at a study, it's always important to look at who the participants are. Some studies use rats, while others use college students. The original study we chose to report on used 46 right-handed adults, 29 of whom were females. They were divided into two groups. The first group had the shock turned off and not replaced with a tone, and the second group had the shock replaced with a tone after it was turned off. Both groups had 23 people total. The first group had 14 females, and the second group had 13 females, which does not add up to 29 females in total. While this could just be a typo on the original study's reports, it is important to keep in mind that accuracy is important when reporting study data. Next, we will look at study design. The study is divided between 2 days. The first day included Pavlovian threat conditioning and immediate extinction. Extinction was the stage when the two groups became separate. The second day was when the difference between the groups was studied. I will go into more detail about this in the next 2 slides. First, looking at day 1 in more detail. The day was divided into 4 runs of equal time. During all runs, the fMRIs were used to measure the brain activity. Shock devices were attached, and a device to measure how much participants' hands sweated were attached as well. The first 2 runs were threat conditioning. The second 2 were extinction. The study used shocks and pictures of faces to create a fear. This was done in the first 2 runs. One specific picture was paired with a shock during conditioning. That was the CS Plus. There were 12 of them with the shock, and the 18 CS Plus unpaired. The 12 with the shock helped condition the fear. Then there were the other pictures that throughout the whole study never received a shock at all. They are represented by the CS negative. After the first 2 runs where the fear was created, the next 2 runs are used to make the fear go away. This is a process called extinction. During the extinction, the 2 groups got different treatments. Both had 24 CS plus and 24 CS negative pictures shown, all without a shock. Group 1, also known as Group EXT, had nothing special happen. The shock was gone, but that was it. Group 2, also known as NFE, which stands for Novelty Facilitated Extinction, had a low-volume tone accompanying the 24 CS Plus pictures. Now we'll look at day 2 in more detail. It starts the same with an fMRI devices being attached, shock electrodes, and the hand sweat measuring devices attached as well. The process of extinction retention took place on day 2. All participants went through 12 CS Plus and 13 CS negative pictures without a shock or a tone. This day was used to measure how many participants no longer had the fear and how many had the fear return within the 24 hours. In the end, the study was able to use the data collected from the sweat devices and fMRIs to determine their hypothesis was correct. By replacing the shocks with a neutral outcome, instead of just emitting the shocks, they found an improved 24-hour retention of extinction. This is great news for people working to find better treatment options for PTSD. Next, we will be comparing a secondary media source that covered this original study to the original study's reports.
Our secondary source is Science Daily. This source shows that new research has identified potential PTSD treatment improvements. The hypothesis states that the treatment can be improved during exposure therapy simply by adding a neutral tone. During this study, the participants were divided into 2 groups, each with 23 healthy adults for a total of 46. Group 1 had the shock turned off, while Group 2 had their shock replaced. This study took place over 2 days. On the first day, both groups of participants were shown a picture of a face that was paired with a shock. On the second day, however, the first group was shown the same picture and the shock was turned off, while the second group was shown the same picture and the shock was replaced with a neutral tone. During both days, the participants were hooked up to watch their brain activity, and the sweat from their hands were measured to test an emotional response. During the study, they found that replacing the shock with a neutral tone led to lowered emotional reactions and higher brain activity. The VMFPC plays an important role in the regulation of anxiety, and the activation of this cortex is associated with learned suppression of fear and anxiety during cognitive behavioral training. It also plays a role in the inhibition of emotional responses and in the process of decision making. The information in this study was presented in a way that the average reader was able to understand the extent of the researchers' findings. And yes, the information was accurate in a way that matched the original study's presentation, but it did not go as into detail. It was simply a condensed summary that included the main ideas. The details that were included expanded on the materials and methods, what was being done to test the participants, and how the experiment was being measured. The only main thing that was not included in this study was the number of females. However, the numbers in the original study do not add up, so it's not too outrageous that this detail is missing. Now the question is why? Why did the author choose to present the information in the way that they did? The author of the secondary source was able to shorten the original study into something that an average person could and would read in a matter of a few minutes. This is important to do because it allows the author to provide readers with important information that may help out patients with PTSD and other harmful illnesses. It really emphasizes that there is an effort to find improvements regarding treatments and that something is going to be done to help people out.
The source was credible because the information was reliable. It was really factual evidence. The platform was of science research news. It was unbiased. It focused more on scientific evidence, and there were experts in the field, and it contained peer-reviewed pieces. The original study was focusing on extinction-based treatments as well as exposed therapy treatments, and so I did want to delve deeper into what extinction-based really was. And so the source that I found was enhancement of extinction memory by pharmacological and behavioral interventions targeted to its reactivation. One of the statements that it had in this article is that the original fear cannot be erased by extinction. It is effective only for some time, and so some basic information to go beyond this is that the article did state that it does extinction-based treatments decrease the condition response, and the purpose of the study was really they wanted to identify whether or not reaction-based interventions can strengthen extinction memories. So extinction-based treatments are most commonly used for PTSD, and the reasons for this is because it delays aversive responses and it is less enduring and prone to decay. How was this conducted? How did they conduct studies to make sure that extinction worked? Well, there were multiple experiments done, and they wanted to do this to make sure that the progress of exposure therapy was improving. For an experiment, you obviously need some structure and some organization and methods. So the subjects that were used for this experiment, you had rats. They were ages 60 to 70, weighing 300 to 350 grams. How were they kept, you may ask? There were 4 to 5 confined to a plastic cage, and obviously these cages did contain food and water. But you also had a different chamber for conditioning, and the rats were placed in there for about 3 minutes, and you also had a different test session for the memory extinction and reactivation. So the memory extinction test would last approximately 30 minutes. The reactivation would last 3 minutes, and they would repeat this 3 times. However, at the very end, there was another test that was different from the memory extinction test and the reactivation. Once they were able to record all the data, the results came out, and from experiment 1, they were able to notice that after extinction learning, there was a presence of spontaneous recovery fear, and this was seen 21 days later. As for experiment 2, when the extinction memory was reactivated, the time-dependent decay was prevented, and for about 28 days, there were no visible signs of recovery fear. The article did state that extinction does have potential in this field within helping those with PTSD. However, it was also stating that there were some flaws with this treatment and that it can be improved. And the flaw that they were pointing out was that extinction can last for a certain amount of time. It is really just a short temporary thing, and so they wanted to make sure that within their experiment that there was a way to really elongate the time period of how extinction will work upon a PTSD patient. So how credible was this source, and did it really relate to the original source? And I would say this source was indeed credible. It was unbiased. You had science base with factual evidence to back up the hypothesis. It was a peer-reviewed scholarly article. It included various references on the reference page. There was a long list. There were multiple authors that were contributing to the study, so there were many minds at work. And what this means is that it allowed there to be an input because there was experts across the spectrum. It was not just one mind. Not only that, but they were affiliated with a reliable program. So you had the psychobiology and neurocomputation lab, and then the neurobiology of memory lab. So these people really do know what they're doing, and they do know what they're studying, and so this really does make it credible. How does it relate to the original study? Well, like I said, this was an extinction enhanced phase study. They wanted to see if extinction enhanced memory was really a way to help those out with PTSD, and I really think that this did help. That, I guess I would say, it made me help understand what this really was. Not only did the original study focus on extinction-based treatment, but it also did talk about exposure therapy. And so for the second source, I wanted to focus on the exposure therapy side. And so the source that I chose was the improvement in quality of life after exposure therapy. The article was talking about how it agreed that exposure therapy is beneficial for those facing PTSD. However, it did also note that there are other treatments that can be used, such as problem solving. And how were they able to find out that it was truly beneficial? They were able to conduct a study to find whether exposure therapy works for those PTSD. And so they did this through an experiment. They did this through questionnaires, which I will talk about later on in the presentation. How does this relate to the other sources? Well, obviously, it focuses on the benefits of exposure therapy, just like the original and secondary source.
How this experiment was carried out. Exposure therapy, problem solving, and combined therapy were used to treat these PTSD patients. The sample size was 60 men between the ages of 25 and 50 that had served 8 consecutive years in a war. What was used for this experiment? They used a quality of life questionnaire, a checklist about symptoms, and it was divided into 15 sessions, 7 groups, 8 individuals for 45 minutes. And by the end of this problem-solving therapy, they had questionnaires. The results showed that the exposure therapy had a higher difference compared to the other therapies. The credibility of this source comes from knowing that it was published by Science Direct, a database that contains a variety of scientific and medical pieces, that it was a conducted study with an organized plan, and that it has multiple references and a lot of people working on it. I will be discussing an additional source that either agrees or disagrees with the initial claims that were seen at the beginning of this presentation regarding exposure therapy and PTSD. This document talks about MDMA-assisted psychotherapy compared to prolonged exposure therapy. First, what is MDMA? MDMA is a psychoactive drug that produces effects like altered sensations, and they begin in about 30 to 45 minutes and they can last up to 6 hours. The most widely accepted treatment for PTSD is prolonged exposure, but for many patients it is hard to endure or it is ineffective. So, after comparing effect sizes, it was found that MDMA had a larger effect in both clinician-observed outcomes than prolonged exposure, and this was also true for patients' self-report outcomes. The dropout rates were also compared, and it showed that MDMA had a notably lower percentage of patients dropping out than prolonged exposure. So this means that for this study that was conducted with patients for treatment of PTSD, MDMA assisted psychotherapy was more effective than prolonged exposure therapy. Is this source credible and relevant to our primary source about PTSD? This document supports the claims of both the media and the primary source by saying that exposure therapy is the treatment that is most accepted for PTSD. Although it does claim that MDMA assisted psychotherapy helped yield better results than those of exposure therapy. But this source was written in 2016, so it is still relevant today, and it was written by Timothy Amoroso from the Department of Psychology in the University of New Hampshire, and it was also written by Michael Workman from the Department of Biological Sciences in the University of New Hampshire, both reliable and credible parties. I will also be discussing another additional source that either supports or opposes the claims seen at the beginning of this presentation. This document talks about comparing narrative exposure therapy, abbreviation NET, and prolonged exposure therapy, abbreviated to PE, for the treatment of PTSD. Evidence shows that prolonged exposure therapy can be effective in alleviating PTSD. In fact, 86% of the clients who received PE treatment had better outcomes than clients in control conditions. PE prevents negative reinforcement that occurs with avoidance by confronting traumatic memories. In an experiment that was conducted on African American women with complex psychiatric and traumatic histories, PE proved that it was beneficial in reducing core PTSD symptoms. Adding to what was discussed in the previous slide, results support prolonged exposure therapy as a highly effective treatment for PTSD with long-term effects, and it is effective in treatment for survivors of multiple traumas. It is aimed towards single trauma PTSD. Studies show that it is effective in clients with complex traumatization, and we know that this source is credible and reliable because it is a clinical review from 2014, which means that it is still relevant, and it was written by faculty of psychology of the University of Bergen, Norway. And we can see that this document supports the claims of the original study, stating that exposure therapy helps with alleviating PTSD symptoms. To conclude, we determined that prolonged exposure therapy is effective in some cases for treating PTSD symptoms, and that is the most widely used treatment for this specific type of disorder. Here is our reference page, which cites every source that we used, including the media source and our primary source, which we have the original study and experiment. And that is it from us today.